This week on Healthy Living, understanding the basics of robotic surgery. South Africa's healthcare embraces the future with robotic-assisted surgeries. And US OBGYN expert Dr. Tyan shares some insight on robotic surgery. Plus, what does a surgery by robots consist of? We go inside the operating room to find out more. That's in this edition of Healthy Living. Hello and welcome to another episode of Healthy Living. I'm Linor Mudu. Robotic surgery, also called robotic-assisted surgery, allows doctors to conduct complex operations with minimally invasive surgical procedures. The operations are carried out using mechanical arms controlled by the surgeon and bearing surgical instruments and a camera, especially to avoid the need for large incisions. It is sometimes used to describe some conventional open surgical procedures. Experts say surgery by robots typically improves efficiency, efficacy, and precision during a procedure and minimizes post-operation complications. According to the U.S. National Institute of Health, the use of robotic surgery for all general surgery procedures increased from 1.8% to 15.1% from January 2012 through June 2018. However, robotic surgery is available only in centers that can afford the technology and have specially trained surgeons. Robotic surgery is revolutionizing the medical industry in Africa, with the first procedure performed in Cape Town, South Africa, 2 years ago. However, there are still concerns around the risks, accessibility, and the costs.
At Urology Hospital in Pretoria, robotics is bringing the latest invention in surgery to African patients. Dr. Ijani, South Africa's first black robotic surgeon, says while good results are always desirable, the procedure is more critical in creating the desired outcome.
The whole world has moved to a point where we say if you're going to do surgery, minimum invasive surgery is the option when available. It must be used, and then other things will come later.
Dr. Ijani says this surgical robotic system offers improved safety, speed, and better patient outcome. Despite the ongoing robotic revolution and the growing number of robotic-assisted procedures globally, there is very limited access to this technology in Africa.
Sadly, it's not that accessible yet, and it's mainly a cost issue. It is American-based technology. The system that is currently available, there are new systems and platforms coming out and possibly 5 or 6 robotic platforms that will be launched in the next 2 to 3 years, which is a good thing because that means competition will bring prices down and hopefully then it will become more accessible.
The demand and scarcity for robotics has seen patients from many parts of the African continent flocking into South Africa for these procedures.
From the SADC region and outside the SADC region, in particular from Botswana, Angola, Mozambique, we've done a sizable number of robotic operations for patients coming from that area, both for the prostate and for other, because we also use it for kidney work at the urology hospital.
While the market is starting to show signs of development, there are some challenges such as high cost associated with system errors and unstable power supply. In addition, observers say public health does not receive adequate funding in many African countries.
Ideally, one would like to see it being able to be accessed in all African countries.
In Africa, it is hoped that as more manufacturers of robotic surgical systems enter the marketplace, it will spur the development of a new generation of surgical robots that are cheaper, competitive, and deployable for use in developing countries.
experts say robotic procedures reduce post-operative recovery times, and patients typically experience significantly less pain and blood loss than in conventional open incision procedures. For more insight, we sat down with Dr. Tyan, obstetrics and gynecology specialist in Virginia, outside Washington, D.C. Among other things, we wanted to know what questions a patient should ask the doctor after a surgery diagnosis.
You have to make sure that you're asking your surgeon questions that are pertaining to your surgery. You have to do your research before you walk into the office. That way your surgeon can guide you the best way possible. Now, in terms of picking your surgeon, before you sign up to surgery, it's very, very important that you get a second opinion. And usually, whenever you do your first consultation and someone recommends surgery, surgery is not a small thing. You have to make sure that you're getting the right recommendation. Even though you feel comfortable with that surgeon you're consulting with, their information is very consistent with the research that you've done. It's always good to get a second opinion. That's the first thing. The second thing is asking your surgeon, is this something you do on a regular basis? Are you comfortable sharing how many surgeries similar to this one have you done in the past?
Who is a good candidate for robotic surgery when it comes to removing fibroid or cysts?
In my opinion, it's everyone. In the past, we used to say that patients who are obese usually are not a good candidate for robotic surgery. With a bunch of research in the field, we have figured out that actually patients with a high BMI do better with robotic surgery. It's more ergonomic, they get better outcomes, they get faster recovery. We used to say it's only good for small pathology, like a small cyst or a small fibroid, or not too many fibroids, just a few ones. But now with the advances that we have in the field of minimally invasive surgery, we are able to push the envelope.
So what is to be expected after surgery? And how does a woman take care of herself?
We counsel our patients extensively in clinic. And I tell all my patients, usually once you manage the expectations, the recovery is much easier. So once our patients go home, they know exactly what to expect. It's surgery. You will have pain after surgery. That's why we give them a number of medications for them to manage their pain after surgery. We tell them things that they should do, things they shouldn't do. The most important thing that I usually stress on is once you go home after surgery, there's a big misconception, specifically for our surgeries that we do in our world, is that you need to stay on the couch or stay in bed and rest to recover. I counsel my patients about active recovery. Usually I want you to walk around the house the same day. I want you to walk around the block the next day. I want you to be active in your recovery. The more active you are, the better your recovery is.
Robotic surgery is used to treat a variety of conditions ranging from prostate and gynecologic cancers to gastrointestinal tract problems. Faith Wambui Mukiri, a resident of Nairobi, Kenya, underwent a mini gastric bypass surgery. The mother of three says her family history of diabetes, hypertension and cancer prompted her to take some preventive steps, including getting the operation.
In 2001, in November, I went to Dubai to do a mini gastric bypass because I was having type 2 obesity. I was 121 kgs. I was pre-diabetic. I was afraid of getting lifestyle diseases because I come from a family that has lifestyle diseases. My mother is diabetic and hypertensive, and so is her mother. And I come also my father's side, my grandmother had a heart disease, and eventually she got a stroke and she demised from it. So that is the reason why I went to do the bypass, which has also changed my lifestyle because I have lost 25 kgs without even going to the gym. My life has become better. I am lighter. I am happier. I'm able to play with the kids, which was a big struggle for me. So when you do robotic surgery, the precision of the surgery is 100% as compared to human intervention. That makes the surgery almost perfect, and the results are amazing. I went in on Thursday morning, and by evening, I was walking. I started drinking fluids immediately. I was monitored. And after the surgery, after 2 days, I was discharged. I checked into my hotel. I was living in a hotel. And the hospital used to send medical aids every day, 3 times a day, to check on me for the 7 weeks to ensure that I am ready to travel back home. So I can say by the time I was reaching home after 1 week, I continued with my life as normal. You could not even notice that I have been done for a major surgery. And from there henceforth, I lost weight continuously, 5 kgs for 2 months, and thereafter progressively 1.5, depending on how you eat and how active you are.
What exactly is robot-assisted surgery, and what does the surgeon actually do? To find out more, we take you inside the operating room with Dr. Tyan.
This is the robot. Basically, you can see 4 different arms. With this robot, as you can see, those 4 arms are identical.
Yes.
So basically, you can use your instruments and your camera interchangeably.
Okay.
So the camera is kind of standard. Now the instruments are different. And the good thing about the robotic platform is that we have dozens of instruments that we can use.
Okay.
So for every different surgery, for every different part of the surgery, we have different instruments. For example, this is a grasper, and we use this grasper to grasp different organs very gently and move them out of the way during the surgery. This instrument here is scissors. You can see they're very, very tiny scissors.
Yes.
But once you magnify the operating field with the robot using their camera, those scissors are very, very effective to do the surgery. So for the initial part of the surgery, what we usually do is we need to inflate the abdomen with gas. So there's a tiny needle that goes usually through the belly button to inflate the abdomen. Usually the needle looks like this. So once the abdomen is inflated, usually we make a tiny incision.
Okay.
Once the incision is made, we have an introducer usually that goes into the port that looks like this one. We put the introducer in, and we place the port through the belly button. Usually it's a very gentle twisting motion.
Wow.
And you do it while you have the camera inside to make sure that you're safely doing the first insertion. Once this first port is placed, that's when we add the additional ports. Every surgery is different in terms of where those ports get placed and the number of ports. This is usually the main port that we use the camera for. Those 2 ports are for the instrument. If you focus here on the floor, there is a laser. You align the laser with the actual port, how we actually move the robot. And once it gets here, you see it's down to the millimeter. We dock the robot. Depending on what type of surgery you're doing, the middle arm is the arm that you use to place the camera. And the way it works is you clip this in, and then you bring it to the port and you attach it. Now the next part of the surgery is effectively choosing the instruments that you're going to use to do the surgery. For example, in this case, we're going to go with a very basic setup, but that's a needle driver. So what we're going to do is we're going to place it here, and then using the camera, you can switch and you can show yourself exactly where you are, and you can see it here very, very clearly.
Yeah.
And then once everything is done very safely, so you just press on this button to be able to move your instrument, and you can see it go in, and you can move it in different directions. The next part of the surgery is you sit down, and those 2 arms that we have, the 2 ports that we have where the instruments are plugged in, mirror exactly what we're doing here. So, for example, we have a needle driver, correct?
Yes.
So usually the only thing that it can do, it can open and close. So you see those two graspers here?
Yeah.
As I'm closing and opening,
Yeah.
that exactly gets mirrored in real time with the patient. One of the things that have been transformational with gynecological surgery and a bunch of other surgical specialties is the ability to comfortably suture using this device.
Thanks for watching Healthy Living. For the latest news and coverage, stay connected to Voice of America at voaafrica.com. You can follow me on X, formerly known as Twitter, at @linochmudu. That's our show for today. Until next time, stay well and strive to make every day a healthy day.